a new nurse impresses TK in Shortland Street.
You want me to steal morphine?
Ta-da! Luke's nasal spray. Luke has one of his allergies, takes a snort, acts a bit weirder than usual.
We're just going to take your dad to theatre.
Dr. Matthews is still in with the AAA, so I said I'd help out.
But you shouldn't.
Why not?
He's as high as a kite and in charge of an anaesthetic machine.
What are we going to do? We have to go into theatre. We have to get Luke out.
How? I can't just bowl in there and say, stop, dope Luke's nasal spray. God, he's out of his tree.
Well, think of something else. Just do it.
Are you heading to Callum's surgery?
They've got the big guns out, Chris and Jennifer.
Nothing but the best for the CEO.
Exactly. Hey, just to let you know, Stan's called in sick, so Luke stepped in.
Okay, thanks. I'll update the paperwork. Hey, grab me when you're done and we'll catch up properly. It's good to have you back.
It's great to be back.
What was that about, Luke?
He's doing Callum's anaesthesia. What's wrong?
I don't think Luke should be anywhere near an operating theatre.
Hey, he's the best anaesthetist we've got.
Yeah, you've been away, you wouldn't have noticed, but ever since the abduction, he's been a little off. Paranoid, erratic.
That doesn't sound like Luke.
Which is why I wondered whether
Whether he's on something.
The trauma. Who knows how he's chosen to cope?
This is Luke Derville we're talking about. For all his peculiarities, the guy's as straight as they come.
I know. You'll be in there with him. Just keep an eye on him, okay?
Fine, but I really don't think that'll be necessary.
That's it? You telling her to keep an eye on him is your idea of doing something?
The first sign of trouble, she'll be onto him in a flash.
And what if you're wrong?
It's like walking into a sauna.
Which is why I paged you. The aircon's been out for half an hour. Where the hell are the maintenance guys?
Well, I've already asked Sophie to get onto them.
Then ask her again. Most of these patients are in here because of the heat wave. They don't need it, and neither do I or my staff.
Okay, I'll get Sophie to give them a hurry up.
Thank you.
Gata.
Talofa.
I'm from the Bureau.
Maxwell.
Right, Mata.
Hot enough for you?
Yeah, I thought it was bad enough outside.
Yeah, the aircon's stuffed. Right, you ready to work up a sweat?
You know what they say, if you can't take the heat, get out of the ED.
I like it. Come with me. TK, this is Roy Mata from the Bureau. Have fun.
Okay, this is Mrs. Lovell. She's had a fall and fractured her left knob.
That's no good.
Can you get a cannula into and put up a lead of saline?
Sure.
Sorry, I didn't properly introduce myself.
TK, right? Roy Mata.
Have we met?
We have now. I'll get that cannula sorted.
Man, it's hot like sa. Fans, get as many as you can and get them in here now.
Okay.
Thank you.
Ted'll probably be in theatre by now.
Close, anyway.
It's going to take ages. Do you want to get lunch or a coffee or something?
I can't. I start my shift now. Call me, though, as soon as he gets out, okay?
Or sooner if anything happens.
Sophie, nothing is going to go wrong. They know what they're doing.
Yeah. I might actually walk down with you and grab that coffee. I better answer that. I'll see you later. Hello, Sophie Mackay speaking.
Oh, you're good to go?
Yeah.
Ready. Luke?
Luke, are you with us?
Are you good to go?
Sorry. Yes, of course, absolutely.
You sure you're okay?
Yes, just double checking the monitor. One can't be too careful.
All right, then. Let's begin.
What's going on with the aircon? Where are the technicians?
I rang them. They're on their way.
Well, they should be here now. Call them again.
You sure you don't want to wait like 5
No,
minutes?
it's unbearable down in ED, not to mention triage in some of the wards. We need to get this sorted now. If the fix-it guy gives you any trouble, call me on my cell.
Where are you going?
To check on Callum. I don't know how long I'll be. Actually, I'll put my phone on silent. Remember, only call if you have to.
Any sign of those repairmen?
Not yet.
Rachel said you're getting onto the aircon people. We're dying in ED.
I rang them again, but they've been swamped with call-outs due to the heatwave.
Okay, do they realise this is a hospital?
Of course, but I can't make them drop everything and come here.
One good thing is they're okay in the theatres. But, you know, the aircon's out in the surgical wards too.
And some of the private wards. Believe me, I know. I've had the private patients calling me directly, complaining their heads off.
OK. When the repair guys get here, make sure they deal to ED first. That's the top priority, not making our paying guests feel comfy. Got it?
Got it.
I swear, if it gets any hotter in here, I'm changing into my lava.
Oh, bro, you need to help people, not give them a heart attack.
And can you organise a bed and a couple of soft pillows?
Sure.
Everything under control?
Yeah, I've just organised for the ward nurses to grab everyone who's been admitted and take them upstairs.
How do you manage that? It usually takes some ages to find beds.
I'm annoyingly persistent. To sign this is for Mrs. Lovell, pain relief and fluids.
Jeez, you really are onto it, aren't you? You're just here for the shift.
At the moment.
I just hope it's not your last. We need nurses like you around here.
So far, so good.
It's early days.
I told you, Nicole's keeping an eye on him.
And what if something happens when she's not looking? What then?
I thought this was a reasonably straightforward operation.
No, it is.
Then what are you two doing here?
On moral support.
Actually, I have to go. You coming?
Not yet. I'll see you soon.
Nice work.
Skin grafts. They're hardly complex.
But they still require precision, a certain skill to cut the skin just so and no more. To slice it, almost like a piece of ham. Ham. Especially nice with a drop of Dijon mustard, don't you think?
What's wrong? Luke, what's happening?
Luke, the alarm.
Oh, Callum's heart rate has increased. He's in pain.
Did you give him enough analgesic?
Well, I thought I did. I'll up his level now.
Luke, are you all right?
Yeah, I feel a bit strange.
Like how?
Is there a problem?
I'm a little lightheaded.
Can you continue, yes or no?
It's okay. The moment has passed. I'm fine.
Are you sure?
Yes, I'm sure.
What happened then?
Oh, it was probably nothing. Glitch in communication. It happens sometimes.
Oh, it's so hot. Oh no, the aircon's still broken. I'll cool you down.
I'm going to be a puddle by the end of the shift. See, you found something to distract you from the heat?
No, she's really good at her job.
Right, yeah.
Don't you understand? Your muscles, they're trapped. You need to let them out.
Okay, cubicle 1.
This is Siobhan Benson, 17. She was found staring at a gnome in someone's garden. They couldn't get any sense out of her, so they called us.
I need to breathe.
Siobhan, up on the bed, please.
She was with friends. She got separated from them. They were drinking and doing mushrooms. She's also hallucinogenic, heart low, and has a fasted arrhythmia.
Well, you better make a break for it while you still got your clothes on.
Yeah, good call. Okay, Siobhan, I'm going to go now. You'll be fine, okay? Okay?
Siobhan, my name's TK.
Need a hand in here?
Yes, please.
Oh, my chest, it hurts.
Your heart's probably just racing because of the alcohol and the mushrooms. I need to have a listen to your chest, okay?
Am I going to die?
Probably not today. I just need to monitor your heart just to be safe. Did you take anything apart from the alcohol and the mushrooms?
Just some caffeine pills. Oh, it's hot in here. I can hardly breathe.
Yeah, that's partly because of what you took and partly because the aircon's not working. Now, how long ago did you take everything? Siobhan.
Whoa, they're breathing.
What?
Kittens. See?
I've never felt like this before. Warm, euphoric.
They've all stopped working. They're just staring at Luke.
Wonder why.
My whole body feels...
Luke, are you on something?
I think I might be.
Yes or no?
What's happening, please?
I think he's as high as a kite.
On drugs?
Nicole, push the emergency button. Get another anaesthetist in here straight away. The anaesthetic tech can hold the fort till then. Luke, you have to leave.
I think I probably should.
Now!
This way, buddy.
Yes, of course.
My anaesthetist was high. Did you have any idea about this?
See the way they rise and fall? Can you see it?
It's okay. Can you give us a hand for a sec?
Sure. Nurse.
Don't leave me.
It's okay, won't be far away.
No, please. TK, come back!
Hey, it's okay.
Where is he?
He's busy, all right?
I need TK.
Just
TK!
Hey, you like making it famous? Look, here. Okay, have a listen.
I love this song.
Cool, isn't it?
Yeah.
Okay, now let's get you back up on this bed, all right?
Karawe tomai.
Kia ora. What?
Have we met before? You look so familiar. What's your name again?
Roy Mata.
Roy Mata who?
Everyone was saying he was like totally out of it. He had to be dragged out of theatre.
Which theatre? Wasn't he on Dad's Op?
I'm not sure. Sorry, I'll find out for you. Huh?
Okay. Bye. Did you hear about Luke?
News travels fast.
Well, was he in with Dad?
He was.
So why didn't you tell me?
Somebody else took over. It's no big deal.
That's not the point. It's my father in there. You should have told me. I shouldn't have to hear that through hospital gossip. What's wrong with you?
Calm down, Sophie. Callum's fine. His surgery is proceeding as planned. Now, where are we on the aircom?
Hey, don't be a fan hog. Shove over. Excellent technique. Well, that needle just slid in there like you've been doing it forever. Well, not everyone has that touch. It's a gift. How are you new?
I'm from the Bureau.
You're very attractive.
It's very kind of you to say.
Do you like taxidermy?
Can't say I know much about it.
How about the occult?
How you feeling there, Luke?
Well, to tell you the truth, not myself. Isaac, hello.
I saw you in Callum's op. Are you all right?
I'm sure I've been slipped some kind of opiate. My behaviour and symptoms are perfectly in line with that.
You think someone's drugging you?
Well, after the death threats I've had, it makes perfect sense.
Luke, are there any prescription drugs that may show up in your bloods?
Well, only my nasal spray. Allergic rhinitis. I've had it all my life.
Do you have the spray on you? It'd be good to know the ingredients.
I can tell you that right now. It only contains beclometasone dipropionate.
Do you have it there?
I do, but I've just told you what was in it.
Why don't you hand it over, mate? It's the best thing.
Thank you.
Why would you encourage Luke to hand over that nasal spray? What if they discover someone's tampered with it?
They will. That's the point. They'll think it was Luke.
Easy for you to be so confident. You're not the one who stole morphine and shoved it in there. I am. What if they believe Luke? What if...
No one is going to believe his ravings. And I made sure he looked as guilty as hell when he passed over the nasal spray.
Oh, I wish I had been there. Actually, no, I wish that you'd done your own dirty work. What was I thinking getting involved?
You were thinking of me. And I'll never forget that, and I will always look after you. Now remember, lots of drug addicts use nasal sprays. That's why we knew it was a good idea.
And if it was anyone except Luke, I would be fine. But he is so straight.
He was so straight. But then he got abducted, which caused stress, which caused drug use, which caused paranoia, followed by an error in professional judgment. It's textbook.
Well, when are the blood tests due back?
Tomorrow. Then Luke will be out of our hair once and for all.
Luke Derville. Oh, what you were just saying then?
I didn't know we were being spied on.
Oh, no, you weren't. I was just,
I was just filling in, Brooke, on what happened to Luke in surgery today.
Well, that's the thing. I've just heard about it. People are saying he was on drugs, but I said, no, not him. He wouldn't.
Well, drug addicts come in all shapes and sizes, Bella.
Oh, you think?
I'm a doctor, I know. And we can't have behaviour like that in theatre. That's what I meant by getting him out of our hair just then. Speaking of which, have you had yours cut recently?
Me? Oh, no.
Oh, well, whatever you've done, it looks great.
Really? Thanks.
Did you come in for something?
And you're sure you can't get it fixed any sooner?
Sorry.
Please tell me that's the aircon guy.
Yeah, it was, yeah. And it's going to take longer than they thought.
But we'll be sorted today, right?
Hopefully tomorrow.
Tomorrow? Oh, this is ridiculous. We'll be dropping like flies by then.
I'm not having a go at you, Sophia.
No, I know. Everyone wants the aircon fix. I'm doing my best, but, my dad's still in surgery and he should be out by now. I'm getting really worried.
Where's Chris now?
Chris, I was in the observation deck. Things seemed to go well.
Yeah, they did, especially after Luke left.
Thank you so much. I really appreciate it.
Oh, Jennifer's good work, mainly.
Yeah, but you being there, that meant a lot.
I don't know about you, brother, but I have a hot date with a cold beer. Keen?
Still got a half an hour left in the sauna.
I'll see you at the IV after then?
Dunno. Been stuck inside all day. Might be nice to get outside in the fresh air for a bit.
I'm off now, guys. Might see you next time, eh?
We're going across the road for a beer. It's a staff local. You're most welcome to come and have a bevy.
Okay. Why not?
Actually, cold beer does sound good. I'll see you over there.
Yeah. Oh, keep one cold for you, eh? Oh, that really hit the spot.
You are not kidding.
Don't worry, I've got the next round.
Oh, actually, I'm gonna head home.
Sure?
Thanks anyway.
Hey, and thank you for your hard work today. I know she was a bit hot in there, but you did really well.
Cheers.
Hopefully we'll catch you soon. Right, another round -1, my good sir.
Oh, you might just be lucky.
What? Almost out of beer?
Mate, they've been flying out of here today. Thank you, Heatwave.
Just in time. One more for my good buddy here, please.
Oh, I think we can manage.
You hear the difference? Aircon that actually works.
It's been so long, I forgot what it feels like. Hey, where's Roimata?
I knew it. We are keen, aren't we?
No, I just think I know her from somewhere.
Yeah, you wish. You're too slow, bro. You just missed it. Here. Take this and drown your sorrows.
I have your test results.
They came back positive, yes?
Beclometasone dipropionate.
From the nasal spray.
And morphine.
You
don't seem surprised.
It's consistent with what I suspected. From the way I was feeling, I thought I might have been drugged. What's this?
It's an organization that helps with drug addiction.
I've told you already, I'm not a drug user.
The evidence suggests otherwise.
I would never knowingly go into surgery under the influence of any kind of drug. But that morphine must have been planted in my nasal spray. Someone's obviously trying to discredit me. Now you think I'm being paranoid and delusional.
I told you to take some time off after your abduction. I think perhaps I should have been firmer.
I didn't need time off. I was stressed, but I was coping. You have to believe me.
It's out of my hands now, Luke. I'm going to have to report this to the Australian and New Zealand College of Anaesthetists. They, in turn, may report it to the Health Practitioners Disciplinary Tribunal. Whatever their decision, your practice is suspended until the investigation is completed.
Of course. Any indication of drug abuse should be investigated. But I will be taking regular drug tests to prove that I'm not a user, believe me.
I'm sorry it's turned out like this.
Not as much as I am.
Can't get batting off private patients like this. So when is the air conditioning coming back on?
They said today, hopefully.
Well, that's not good enough. I told you to get this sorted. I expected it would have been done by now, quite frankly.
What would you like me to do? Go and grab a wrench and try and fix it myself?
I don't want sarcasm, I want results. Problem?
Yes. You swanned off yesterday to go check on Dad and left me to deal with all the aircon stuff, and now you're having a go at me because it's not happening quite as quickly as you'd like it to? Well, I'm sorry, but I did do my best. Even though I was worried sick about my dad, I did my best.
Sophie, your dad is fine. I want you to get the aircon guy on the phone and find out when he's going to fix the problem. Do you think you can manage that?
said you're meeting with Chris.
He thinks I'm an addict. Not you too.
I was in the viewing room. I saw the way you acted in theatre yesterday.
Well then, you'll be happy to learn that I've been stood down.
Nick's been stood down.
Well, no one's going to believe him when he bangs on about patient files being tampered with then.
I think he's too down in the dumps to bang on about anything.
So we're in the clear.
It would seem that way.
Why aren't you smiling? You've got a briefcase full of money and we've still got our careers. Your plan worked.
Are you all right? Do you need a nurse?
No, it's all right. It's just a twinge. I'm good now.
Hey. Sorry, I tried to get it earlier, but things have been a bit crazy.
Crazy how? You look stressed.
Doesn't matter. It's you I want to talk about. How are you feeling this morning?
Well, I still have all my brain cells. But I know when something's worrying you, Sophie. What's going on?
You know what he's like. He'll probably worry more if he thinks you're keeping things from him.
Thank you. He's still in the room and he can speak for himself. I want to hear everything. What's happening upstairs? Sophie.
Okay. The aircon's been out for a couple of days.
A couple of days? Which areas?
Triage, ED, some of the surgical wards, some of the private rooms. The private patients have been ringing non-stop, complaining.
When's it going to be fixed?
I'm not sure. The repair guys are here now, but they can't give me a time.
Sophie, can I see you outside, please?
I'm on a break.
This will only take a minute. Sorry, Callum. What do you think you're doing telling him about the aircon?
He wanted to know why I looked so stressed, so I told him.
And what exactly did that achieve except to pass that stress onto him? I could see it in his face.
Wait, you're accusing me of stressing Dad out after what you did to him?
This is quite different.
You betrayed him, Rachel. You dumped him. You moved on. What are you even doing here?
We're still friends. We always...
Oh, please. The only reason why you're hanging around is because you feel guilty that he got burned trying to save you and your lover. You're just trying to make yourself feel better.
Okay, stop right there. I know things are difficult for you, and I have been trying to make allowances. But I am still your boss, and I expect to be treated with a proper respect.
After what you did to my father, I could never respect you. And you know what? I can't even stand working for you anymore. So you can take your job and shove it.
The Works meet the cast of the Gate Theatre's production of Wuthering Heights, and Pat Short shares his recommendations for the festive season on The Works tomorrow night at 8:30. Next, though, it's Doctors.